clean catch midstream urine collection. Check the patient's electronic health record or lab requisition form for the testing order. Determine any special requirements for testing. Gather necessary PPE and supplies, including a sterile collection container and wipes. If the sterile container or personal wipes appear to have been opened or the sterility seal is broken, don't use and dispose of properly. Create a label with requested information. Place it on the container, not the lid. Greet the patient, identify yourself, and state your title and the provider you work with. Verify the patient using 2 identifiers and ask them to spell their first and last name. Explain the procedure and the reason for it. The following instructions are what you'll need to provide to a female patient when they're ready to collect their own urine sample. Start by washing hands. Open the towelettes and place on their wrappers. Remove the lid from the specimen container and place it on a paper towel with the inside of the lid facing upward.
Okay. All right. Can you verify your name and date of birth for me?
Yes, that is me.
Okay.
Spread the labial folds apart, which are the lips of the vagina, with your non-dominant hand to expose the urinary opening. Keep your hand in this position throughout the procedure. Take the first towelette and clean down one side of the urinary meatus using a front-to-back motion. Do the same with a new towelette on the opposite side. Take your third towelette and cleanse down the middle of the urinary opening using a front-to-back motion. Continue holding the labial folds apart and void a small amount of urine into the toilet. Immediately put the specimen container into the stream for the next part of the void. Be careful not to contaminate the inside of the container with your fingers. After filling it about half full, remove the cup from the stream. Let go of the labial folds and finish urinating in the toilet. Securely attach the lid to the specimen container. Wash your hands and place the specimen in the designated area. The following instructions are what you'll need to provide to a male patient when they're ready to collect their own urine sample.
So the first thing you're going to do is you're going to wash your hands. You're going to take the towelette, go ahead and open it up and place it back down on the counter with your specimen cup. When you take off this lid and set it on the counter, make sure you have the lid facing up and don't touch the inside of the rim.
Okay.
Okay? Can you verify this is your name and date of birth?
Yes.
Expose the penis and retract foreskin if uncircumcised. Cleanse the area around one side of the tip of the penis and the urethral opening with a towelette. Repeat on the other side with a fresh towelette. Cleanse across the urethral opening with the last towelette. Void a small amount of urine into the toilet. Put the specimen cup into the urine stream and fill half full. Remove the cup from the stream and finish voiding in the toilet. Securely attach the lid to the specimen container. Wash your hands and place the specimen in the designated area. Perform hand hygiene, don an impermeable lab coat, goggles, and gloves. Make sure the label is still legible on the container and the lid is firmly in place. Put the labeled container into a specimen bag. Fold the requisition form and insert it into the outside pocket of the bag. Refrigerate the specimen until transport. Remove PPE and perform hand hygiene. Document that you gave the patient instructions and answered any of their questions. Log the patient's name, date of birth, the date and time of collection, test results, or the date the specimen was sent to the laboratory. Physical and chemical urinalysis. Check the patient's electronic health record or lab requisition form for the testing order. Perform hand hygiene and don PPE, including impermeable lab coat, gloves, and protective eyewear. Assemble your equipment and supplies. Check the expiration dates on the urine reagent strips and control if applicable. When required, perform control tests to determine the validity of the test and record the results in the control log. Check the collection time and bring the urine to room temperature if applicable. Gently mix the urine in the covered container. Pour urine into the labeled centrifuge tube, filling it to 12 milliliters or about 3/4 full. Examine the urine to assess its color and record the results. Common urine colors include pale or straw, yellow, amber, or dark amber. Record the odor only if it's abnormal. Some common terms include strong ammonia odor and sweet or foul smelling. Follow your facility's guidelines. Assess the clarity or transparency of the urine by holding it against a piece of white paper with dark print or lines. Common terms to describe clarity include clear, slightly cloudy or hazy, cloudy, can't see through it, and turbid, cloudy with clumps. Gather your supplies, including the patient's urine sample at room temperature, a bottle of test strips, paper towels, and clinical analyzer. Turn on the analyzer and select Strip Test. Enter the operator and patient information. Carefully remove a test strip from the reagent strip bottle. Avoid excessive touching of other strips in the bottle or the testing area on the strip selected. Immediately replace the lid. Select the Start button and immediately dip the test strip into the urine. Blot the strip by placing it on its side on a paper towel. Immediately place the strip on the channel of the table with the test strip facing up. Enter the color and clarity of the urine. Print or upload the results according to your facility's guidelines. Clean the unit according to the manufacturer's instructions. Dispose of the test strips into a biohazard waste container or follow your facility's guidelines. Once you complete your testing, follow your facility's guidelines for disposal of the urine. Clean and disinfect the test area. Scan in the printed results if they don't automatically upload into the patient's electronic health record. Remove gloves and perform hand hygiene.